Welcome. Wow, what is this? Week 3 already. I don't know. It seems like we just started, but you all are really doing real. Oh my God, now I got the hiccups. You really are doing very well in learning the complexities of ICD10 PCS. As I'm pretty sure you all have figured out, it's very different from diagnosis coding, ICD10 CM, and it's different from CPT. I think it's easier because you actually build the code instead of trying to find something that is closest. But everybody has their preferences, and here we go. So what I decided to do this evening, based on the feedback that I've been getting over the last couple of days or so, is I picked out 3 short case studies. They're actually snippets, the summaries from real live op reports. And I thought we would walk through building the ICD-10 PCS code for each together. So hopefully that will help you kind of put things in a little better order in your head. Okay. And of course, as you have any questions, I want you to ask, either turn your microphone on or type it in the chat box, whatever makes you more comfortable. Okay. So if you have your PCS book handy, do you want me to give you a minute to go get?
I have it.
Okay. All right. So let's start with the first one. The procedure is a urethral mediatomy. Okay, and I'm going to read the summary of the case study here for you as you follow along. I didn't have a bouncing ball, but I'm sure you can do it. Okay, under satisfactory general anesthesia, the patient was placed in a supine position and prepped and draped in the usual fashion. A Bougiabul was used to identify the caliber of the urethral meatus. At this time, it was type 212 French, a result of congenital urinary meatus stenosis. A 14 French Bougiabul was introduced in an incision made over the Bougiabul and extended. Sutures were placed at the apex and laterally to reapproximate the mucosa. Hemostasis was good. The urethra was recalibrated to 18 French at this point without difficulty. Neosporin ointment was applied, and the patient was sent from the operating room to the recovery room in satisfactory condition. Okay. So we have a couple of things here, and one of the reasons I chose this is because there are a lot of fancy schmancy terms in here. If we start at the top, we have Bougiabul, and well, all right, and then we have urethral meatus, and that goes along with the procedure, which is a urethral mediatomy. Okay, and it's being done for the patient who has congenital urinary meatus stenosis. Okay, which all gives you clues as to how we are going to code this. So the first question I want to ask is, do you know what urethral mediatomy is?
It's making the tip of where the urine comes out of the penis, making it bigger. Right?
Okay. But not at the penis. This is
at... with the urethra. I'm sorry.
No. You're right. The urethra goes through the penis, but in saying the penis, it makes it sound like it's at the exit point.
At the exit point, right?
But it's not. It's actually at the bladder point.
Okay.
Okay. All right.
Okay.
Do you know what a Bougiabul is?
No, I do not.
Okay.
I would have to look it up in my book.
Okay, well, that's exactly one of the points I wanted to make is you need to know what the heck they're talking about, and you need to know what all the words mean so you can then pick out what you need to do your job. So get that medical dictionary out. And honestly, I use Google a lot. But you got to make sure that you're using a medical dictionary. I don't
Right.
think you would find metotomy in a regular dictionary, but you know there are a lot of words that we use in medical terminology that are English words that mean different things in business or in other uses. As you know, English, thank you very much. There are 12 different definitions for every word. So it's a language that requires a book 2 inches thick called a thesaurus. So you can give me 20 other words that mean the same thing as the word I started with. Okay. In medical terminology, the words are very, very specific. A letter can mean a whole different procedure or diagnosis. So this is very important. So this gives me the opportunity to reinforce that you need to keep a medical dictionary. I prefer paper, but you need to keep a medical dictionary by your side. Now, one of the things I will tell you, as some of you, like Jennifer, who are soon maybe about to go out into the working world, I want to tell you that some facilities do not give you open internet access. Excuse me. So you may not be able to pull up Medline Plus or another medical dictionary online. So this is another reason for you to get a paper medical dictionary that you can have right there on your desk. I like it especially if I'm reading case studies and patient records online. I like to be able to look back and forth and back and forth. So if I have a paper dictionary, then, and I have the case study on the computer, just like with my paper coding books, okay? So urethral, yes, you know, excuse me, it's the long tube that carries urine from the urinary bladder out to the outside of the body.
Right.
The urethra does this in both the boys and the girls. And there was nothing in this, there was nothing here that said this was a boy, Jennifer.
Right. I'm sorry.
It's okay. But if the gender or gender anatomical sites are part of the building of the code or determining certain parts of the code, then you would query to find out, okay? So it's good that you have knowledge, but just remember that especially when you get on the job, I mean, of course, you know, when you're taking a test in class, you want to get it right. But it's even more important for you to get it right when you're on the job, because that's somebody's life, somebody's money that you're picking at, okay? Exactly. So it's very, very important. Double check. If you're even a little, I'm not sure, okay? Then you definitely want to make sure that you look it up. And this is what I do, okay? If I'm not absolutely positively sure, so I look it up. If I get it right, I do the happy dance. Look how smart I am, okay? And then if I was not so right, I have the opportunity to make it right before other people see, and then everybody else thinks I'm so smart. You see? It's all an act, ladies and gentlemen, but I'm sharing my magic, my magic with you. Okay, so we now know what the procedure is. It's a urethral mediatomy. And remember, OTOMY from medical terminology class is an incision, not excision, incision. All right? And of the meatus, the urethral meatus, which is where we get this word from. Again, reinforcing why you had to take medical terminology and anatomy and physiology before you got to coding. Okay, this is very important. If you can't take apart some of these words, well, you're going to look it up in the dictionary, but being able to take it apart is also going to reinforce some other things, okay? So let's take a look at our summary again. So we have under satisfactory general anesthesia, patient was placed in a supine position. Who wants to tell me what is supine? Face down or face up?
Face up.
Yes. What's it called if they're face down?
Oh shoot! Why you do that to me? You tell me the
Because
word.
I'm your teacher. Because I'm your teacher and I was born to torture you. That's why. Prone.
Prone. Okay.
Oh, yeah. Okay. All right. So we know general anesthesia. So we know that this is which section of the PCS book?
That's in medical surgical.
Very good. Okay, Luanda, you have to talk occasionally. All right, you can't let Jennifer, you know.
Please.
She can have it. Yeah. I'm trying to stay tuned.
Thanks a lot.
Okay. All right. So we have the first two parts of our code. And that's a 0. It's a funky font, and I forgot to change it, but it's a 0. Okay, so we have 0 for med-surg. And where is the urethral meatus? Look, I'm covering it so I don't see it. Okay. Where is the, Luanda, where is the urethral meatus in what body system? The answer is on your screen. Come on. Luanda.
Oh, I'm sorry. I thought I had unmuted it.
I understand. Okay. What body system is the urethral meatus involved with?
That's not on my screen, but I'm a guess and say the urethra, not the urethra. I'm thinking of the urethra, not the kidneys, right?
What body system? The whole system, not an organ, a system.
Urinary.
Yes. What do you mean it's not on your screen? You guys can't see this?
I do. You know what? I see it now where it says the T, urinary system, but I didn't see it at first. My eyesight is getting bad. I don't have glasses.
Your eyes didn't want to let you cheat and force your
Exactly.
brain. There you go. Very good. So we now have the first 2 of the 7 characters for our PCS code. Med-surg 0, T for urinary system. And that's how this is what we did, what we pulled out of the case study to tell us the answers so we would know, right?
Right.
Okay, so now we have to do the next 2, repair with the root operation term. We have sutures were placed and the urethra was recalibrated. And that tells us that nothing was removed, nothing was put in, it was repaired. The problem was she had urethral meatus stenosis. What does stenosis mean?
It's restricted.
Narrowed, right?
Narrowed.
I always use the example of, you know, when you're on the parkway or the interstate and they have 1 or 2 lanes blocked off for construction, which is like all the time in Florida, okay? So you go from 4 lanes to 2 lanes, that's stenosis of traffic. okay? Because it's narrowed. Make sense?
Yes.
Okay, so you know, and as we saw here in the second paragraph, the meatus was at 12 French as a result of the stenosis. Then they made an incision, enlarged it to 14 French, and then recalibrated it to 18 French. Okay, so that is our repair of the urinary system. And which particular part? Now, Lawanda, what's the organ involved for the urethral mediatomy?
The kidney. Urethra.
Wanda,
Urethra.
urethra, not ureter. Urethra.
Urethra.
Thra. Where is that?
What organ?
Okay, what organ? And we're going to go back to where we talked about using our medical dictionary to understand the words. Okay, urethral relates to the long tube-like structure that passes urine from the urinary bladder to the outside of the body. Urethra
is the urinary bladder.
Ureter, without the H and an extra E, is the tube that goes from the kidney to the bladder. Then we have the bladder, then we have the urethra, which goes from the urinary bladder to the outside of the body. Okay?
Okay.
So now we know that the body part, the fourth character, the body part is the urethra. Okay? So you see how we're piecing this together? We know it's the medical surgical section, the urinary system. The urinary system, the root operation was to repair a part of the urinary system. Which specific part of the urinary system? The urethra. Okay? Does that make sense to you or no?
I'm slowly getting it.
Okay, we can slow down.
No,
right.
I came on a little late, so.
Okay, well, that's good. We have 2 more case studies to do after this, so it's okay. All right? And it's all a process, a learning process. So now you may remember that we saw a Bougiabul was used in the procedure, and Jennifer said she didn't know what that was, and I want you to know, truth is, because you know I'll always tell you the truth, I didn't know either. So I Googled it.
You know, I looked it up in the dictionary and it just has bougie in there. I don't see the Bougiabul.
The Bougiabul is, it's just the difference between the 2 tips.
Okay.
But yes, bougie is the actual instrument and the abule is just the size and the version of the tips. Okay, so basically what you will see in the definition is that it is a metal rod with an attachment at the end that is inserted through a natural opening of the body. And when you look at it, you can see that this would go right up the urethra to the point of the repair. Can you see that? Does that make sense?
Yeah, it kind of looked like one of those balloon catheters to me, just by the picture.
Yes, that's very good. Yes, except I don't think it's a balloon. But yes, you're absolutely right. It does look like a balloon catheter. Yes.
So it comes in both of those sizes?
And a couple more. If you Google it and then look at and then click on images, but that'll probably confuse you.
And you honestly say that goes into the urethra?
Yeah. Just like a urinary catheter might go, only this has that doohickey at the end, so it can it can do whatever it needs to do.
Okay.
Okay. So now you guys are the smartest ones. You're going to know what a Bougiabul is. Mm.
I hope I remember. I think I remember this though.
You know what? When you go to have dinner with your family, just use it, with throughout the conversation at dinner or breakfast tomorrow, whatever.
Like
right?
I'm crazy.
Yes. No, would you say what? You don't know what a Bougiabul is? Really?
Like, where y'all been all y'all life?
Yes, everybody's supposed to know that.
You need to say that to your children, your youngins, right? It's like, what are they teaching you at that school if you don't know what a Bougiabul is? Okay. All right. So the important thing is now that we know that it's a metal rod with a certain doohickey at the end, all right, that's going to be passed right up the urethra. That tells us what our approach is, right?
Mm-hmm.
Yeah.
Via natural or artificial opening endoscopic.
Okay.
So you see how we're building this, pulling words out of the scenario. And then there is no device and no qualifier. So we're done. The code that you would report for this case study would be 0TQD8ZZ. And just a reminder is you might look at the Bougiabul and say, well, that's a device, but remember in PCS, unless the device stays in the patient after the procedure is over, we don't report the device, okay? And if you want the reminder, you'll see that it was recalibrated, hemostasis was good, everybody was happy, and so there we have it. Okay? Does that help you understand how we build codes, how it's different?
It does, because on some of the questions, I was like really confused. And I was like, how are they getting it? But I really got it now. I've been lost the whole time. These past 2 weeks, I've been lost.
Are you found now?
I think I am. Maybe with a little more guidance, I might really have it.
Okay, well, we got a GPS coming. Okay. Now,
I've got a quick question.
Yes, ma'am.
Because this is something that'll probably confuse me. Well, I mean, confuse me, I guess. Okay. I looked up, because you can look up some of the procedures up in the front of the book and get the first 3 letters or first 3 characters. Okay, I looked up urethral mediatomy. Okay, it's not in there.
Mm-hmm.
But mediatomy is.
Okay.
And when you look it up, it says drainage urinary system. Now, I would know based on the procedure, because reading that, I'm like, that's not a drainage. They're actually,
that's not a
changing
drainage.
Right.
Really?
So that can, yeah, it says.
Okay.
It says C drainage urinary system 0T9.
That's interesting. All right, let me take a look. And then I will explain MEA, MEAT. I sing the alphabet song in my head all the time. I see. That's interesting. But look directly above it. You see metoplasty, urethra. See repair, urethra, 0TQD. Okay, so this is very important. I'm so glad that you asked this question. So
and I'm trying to find where you guys are at.
Oh,
okay,
in the
right
index.
here.
The index
In the index.
Okay.
Okay.
If you got the book they had at the bookstore, it's page 114.
114, okay.
Okay. So what this means is, again, medical dictionary. Now we know metoplasty, the medical terminology.
At the door, I'll be right back.
Okay, go ahead. The suffix plasty in medical terminology means to repair.
Repair, right.
So that is a more accurate term, used for this procedure.
Okay.
So what I would say is you need to be aware, and I would look up both and keep going back and forth to the scenario to see which matches better.
Right.
Because your job is to report what happened. And this, see, I told you, you are so good at this. This is exactly what we need to remember is that.
Excuse me, guys. Please give me about 10 minutes. Someone is here to pick up my husband's bike.
Okay.
And I'll join as soon as I can.
Okay, we'll be here. All right, so, but the good thing about you asking that is I get to reinforce that different physicians call different things. Okay? Right. It's one of the reasons why we need code sets, because the code says exactly in detail what was going on. And you can see here that meatotomy, and let's go back to the actual meatotomy, is accurate because an incision was made into the meatus.
Right.
That's true. But the reason the incision was done was to repair it. So metoplasty is more accurate, but they're both correct. And that's why you have to read the entire op notes or procedure notes so you get a better idea of what was going on. Does that make sense?
It does, because that's what I said. I was reading it and I'm like, no, this isn't drainage. It's like,
exactly.
This is changing something, so it's repaired.
And see, now you could make an incision for drainage purposes. So this is not wrong.
Right.
But it's not what happened in this particular case.
Right, yeah.
And that's where it comes back to a good reminder that you can't just read the name of the procedure at the top of the op notes and code it without reading all that long, boring stuff. But it's interesting too, because you get to learn new things, you know?
Yeah. Get to find out what a Bougiabul is.
Exactly. It's and you know what is especially, and I know I probably bored you to death over the time we have in different classes about, but I took my father at the time, I think was like 89, and I took him to the urologist, and he didn't want me to come in with him. So I waited in the waiting room with my mother, and he came out and he said, okay, we need to come back in 2 weeks so I can have some procedure. And I said, what procedure? So I had to go, I went in the outdoor, you know, to talk to the nurse at the inside desk. And I said, okay, this is my father. I got to know. Just tell me the name of the procedure you want him to have.
Right.
Now, because then I knew I could go research it. I wasn't going to, you know, test her knowledge. And so I went and researched it. And what was very interesting is, maybe 6 months or a year before, my father had a stent put into his brain. He was diagnosed with normal pressure hydrocephalus, and so he had a stent put into the ventricles of his brain, and a catheter came down and drained the excess fluid off of his brain into his abdomen. And I could totally understand how the urologist might ask my father, do you have a pacemaker or other heart stent? Because that would be normal for an 89-year-old man. And my father said no, because he did not. But when I started doing research on this procedure, it said this procedure cannot be done on anybody with a stent in the body because the stent will pop out, which is not good. I mean, it wouldn't be good if the stent was in his heart, and it certainly wouldn't be good because the stent was in his brain. Okay.
Yeah.
So I called the urology office and I explained why we were canceling the procedure. But there would be no blame here because he would ask my father if he had a stent, or probably in his heart, because that's the norm.
Right.
Without asking a complete answer, and being 89 years old, my father was not the most accurate reporter.
Mm-hmm.
Okay. So anyway, the point is that different pieces of information show up in different places. And I totally forgot why I even started that whole diatribe. So it's really important that you use that medical dictionary and read. Okay. All right. Great.
Oh, we got onto it because the book said drainage, and this was actually
that's
repair.
right, drainage. Okay, thank you. See, you could audit my brain. I appreciate that.
Hey,
Hi, Nikki.
I had to take my mom to the doctor. We're just getting back.
Okay, well, I'm glad you were able to join us. Tonight, we are abstracting and coding scenarios. They're short summaries of case studies, so we could practice pulling out the words, okay?
I had a problem.
What's your problem?
Okay. It was, let me see. I'm going to have to pull it up. It was with one of the questions we had on the last quiz. I had a problem finding the correct, I'm trying to get my bearings straight. Hold on.
Okay, well, let's do this case study together.
Okay.
And then that'll give you a chance to kind of find your spot there. And and I promise you I won't go anywhere until I answer your question, okay?
Okay.
All right, so here we have a cystoscopy with bladder biopsy. I guess it was urology day in the case studies. Okay, but I promise the third one is not urology. Okay, all right. The patient was taken to the operating room and placed in the lithotomy position and prepped and draped in the usual sterile fashion. A 22 French cystoscope was then placed into the urethra and advanced into the urinary bladder, showing mildly enlarged trilobed view of the prostate, which tells you what, Jennifer? The gender of this patient is
a male.
Yes. Upon entry to the urinary bladder, the bladder was examined with 30-degree and 70-degree lenses. A small foreign-like projection was found distal to the right urethral orifice. Biopsy forceps were used to biopsy this lesion, and Bugby cautery was used for hemostasis. Upon completion of the biopsy, the rest of the bladder was examined, showing no further lesions. Urethral orifices were in the normal anatomic position. Urethral orifices were in the normal anatomical position with clear urine. The cystoscope was then removed. An 18 French catheter was placed. The patient was taken to recovery in stable condition. The patient went home with the catheter since we will see him tomorrow morning. The patient will follow up for pathology results. Okay, lots of new words here. I hope you have either remembered from medical terminology, or that's why we always have a dictionary handy. Let's start at the top. Lithotomy position. Who can tell me what position that is on the table? Come on, you're both women.
Oh, you mean in stirrups?
Yeah. No, you're in the okay, let me blather.
Yes, you're on your back.
You're on your back.
Bent.
Yeah.
So they may or may not be in stirrups, but they probably are in stirrups.
Okay.
Okay. Pregnant is a cystoscope. Take that apart for me, somebody. I mean, cystoscope, sorry. Cysto?
Cysto has to do, oh God, hold on. I got my dictionary.
Good. Okay.
My coworker, he's a RN, and he gave me his tabers.
Oh, very nice.
Okay. CYS. CYS. Okay. CYSTO.
CYS, CYSTO, CYSTOS, CYSTO, SCOPE. I spy with my little eye.
Okay, here we go. I got it. Cystoscope. The bladder.
And scope?
It is, scope means to inspect or to view.
Very good. So a cystoscope is an instrument used to view
the bladder.
In this case, the urethral bladder. I mean the urinary bladder. Too many words beginning with U. Okay.
Yeah.
It's like, you guys, you couldn't come up with some other words? No. Ureter, urethra, whatever. Okay.
Again, all words created by man.
Yes.
So right, Jennifer.
And I hope nobody gets offended, but old white men.
Yes.
Okay.
Yes.
Yes. God, they annoy me. Okay. Did I say that? Oh, this is being recorded. I didn't say that. It's your imagination. Okay.
I know what it is. You can help me with. It is the application quiz. It was the 2 questions. I got 2 of them right, but I had them in the wrong order.
I did the same thing.
And then the other ones, I need a little help clarifying. I think I had like a number off. I looked at both of them and I thought I picked the right one. That's the one. If you could help, because I can't seem to, it was that last one that I got 2
Barbie Tuttle? Is that Barbie Tuttle? All right, we'll look in a minute. Let's finish this first, okay? But we won't forget.
Cystoscope, it was.
Okay. So let's take a look at what we got. The patient was taken to the operating room. That makes it easy. This is going to be in what section of PCS?
Medical surgical.
Very good. And we already know this is the urethra. Advance into the urinary bladder, which means what body system?
Urinary.
Very good. So we have OT. All right, and next we have to figure out what the root operation term was. And this goes to a word that maybe you should be familiar with, which is biopsy.
Yes.
Now, there is no root operation term biopsy in ICD10PCS, but a biopsy means to take a little piece, a specimen of tissue or organ, and in PCS, to take a little piece of part of an organ is an excision.
Yes.
If you take out the entire organ, that's a resection.
Yeah.
Okay, so we know because this is a biopsy that we're going to use the root operation term excision. And we know because it said upon entry to the urinary bladder that the organ, the body part, character number 4 is going to be bladder.
Yes.
Are we good?
Yes.
Yes.
Okay. Next, we have to determine the approach. And you'll notice that the case study said the cystoscope, this time, unlike the first one where we had to figure out what a Bougiabul is and know how it works, this time the case study told you directly. Cystoscope was then placed into the urethra. The urethra is a natural opening to the outside of the body. The cystoscope is an instrument. So 8 via natural or artificial opening. Endoscopic is the approach.
Mhm.
Good?
Yes.
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 Good. All right. Now, as I was reading this, I think there's a mistake here. Let me look quickly. Now, you know that because a biopsy is done for purposes of accurate diagnosis, right? You all know that?
Yes.
Okay. So then you know that that 7th character,
Yes. Diagnostic.
is going to be diagnostic. Okay? So we end up with all 7 characters, 0, T, B, B, 8, Z, X.
Yes.
Okay?
Yes, but what about
Can you
the,
say again why you say that it will be X diagnostic?
Because a biopsy is performed for purposes of determining an accurate diagnosis.
Okay.
Okay? So
So
we know that that is diagnostic as opposed to therapeutic. Okay?
therapy would be more of a treatment.
Therapeutic, which would be a treatment, would be something like removing a lesion to make it better.
Okay.
Okay.
Okay? But here we're taking a piece so we can send it to the lab so they can test it to
Test it.
see if there's disease or cancer, malignancy, or whatever. Okay? A biopsy is a known diagnostic procedure. Okay?
So in order, if it where it would be therapeutic would be if they already know that it's the part of is cancerous and they just remove like part of a lung. That would be more of a therapeutic.
Yes.
Okay.
If they remove that, now you know in your lungs you have 3 lobes on one side, 2 lobes on the other, and they can remove 1 lobe and you could still breathe.
Yeah.
So that would be an excision, except there's something about that okay. But yeah, so that would be removing part, if we knew it was diseased, okay. Let's say they did a chest x-ray, which is also a diagnostic test. They did a chest x-ray, they saw this huge mass. So they went in with the intent to look and probably remove the lobe. Then yes, that would be therapeutic, not diagnostic. Okay. Which goes back to what I've been saying, which is as difficult, as tedious, as much in a hurry you think you are, you have to read the whole operative report or procedure report.
Okay.
You have to read all those words. Now, let me give you a couple of tips, okay? First of all, do you all have a finger?
Yes.
Notice which finger this is. This is the pointy finger, not the bad finger, okay? But you can use whichever finger you want. This is proven, okay? I sometimes look at all of these words on this screen, and the typical op report is going to be 2-3 times this length. Okay. I look at, and my eyes glaze over. And my brain says, too much information, does not compute, go away, leave me alone, stop. Okay. So I use my finger and I point to each word, one word at a time. Not only does it actually increase the speed with which I read, but what it does is it forces the eye to send one word at a time up to your brain. So your brain is getting one word at a time, and it's much easier to understand. When you look at the screen and all those words, your eyes automatically are trying to take all of those words and put them up your optic nerve into your brain, and your brain is going, nah! Okay? So this helps you improve your comprehension. It enables you to stop at a word that you may not know and look it up in your dictionary. So then you are understanding better what is going on. Okay? This is very important because this is the job. Interpreting the documentation and interpreting into an accurate code that tells the story about what happened. Do any of you guys ever watch CSI? There's CSI Miami, CSI.
Oh, I love them. I've seen every single episode of Miami.
There you go. Okay. You know how whenever they get to a crime scene, they always go with these little teeny tiny flashlights?
Yeah.
Right?
Yeah.
And you go into this big room looking for specimens. Why are you using a little teeny tiny flashlight? Wouldn't the natural be to go get big floodlights, okay? But if you have the whole room lit, your eyes again are taking all of this information from the room and trying to shove it up your optic nerve into your brain. When you use a little teeny tiny light, your eye only looks at whatever's inside that little light circle. And that's how they can see that one strand of hair or the 2 spots of blood. Otherwise, you wouldn't see it because you're too busy looking at everything. So this is why, and especially when you go to take your next certification exam, okay, remember, you're allowed to bring your finger to the exam. Any one of them. Okay.
Can you
All
take
right.
you can only take your coding books, right?
Yes.
Okay. So you can't take a dictionary.
A HEMA, I think, allows you to take a dictionary, but I do not think CPC lets you use a dictionary.
Yeah, I don't think APC doesn't let you.
Yeah. Okay.
Okay.
All right. But that's why one of the reasons why we're going through this, and I want to remind you what you learned in medical terminology about taking words apart and interpreting them and tickling your memory cells from when you took midterm so you'll remember. Okay?
Any words I have any problem with, I write in my book.
Very good. Writing down helps reinforce the eye-brain connection. So that's really very good. All right, you ready for the next case study?
No, I have a question about the last one still.
Okay.
What about the catheter that got placed that doesn't have to remove till the next day?
I saw that, but I think because it's being removed the next day and not staying in the patient.
A longer extended time.
Yeah. Yeah. Okay. I think it needs to be in there as for a
drain.
Yeah.
Would it be the same as like a drain, like after a JP drain or something, like after surgery, but it's just for a day, and then they remove it at the doctor's office?
Yeah,
Like
yeah.
that?
And I
Okay.
think it's also because of the biopsy. Remember, that's a cut in the dermis of the internal. It's probably also used to make sure that the urine does not get underneath into the dermis and into the blood system
Right,
Oh,
okay.
through
okay.
the cut. Even though they cauterized it, you know, I wouldn't want to take a chance with infection like that,
Okay.
especially in a male, because it's got to go a
A
longer
lot longer.
path. Yeah. Okay. But yes, that's exactly why I thought there was a mistake as we were reading that. Because wait a minute, that catheter. But no, I think it's because it's not even 24 hours for it to
Okay.
stay in. Not that it's really something that, like a J stent for bladder incontinence,
Okay.
that's going to stay in there. Okay.
Okay.
All right.
Okay. I figured I better ask it because even in the book, it did not list Z was your only option for device.
Yeah.
Right.
I was like,
Right, exactly. And that is yet again, that's another good observation. When you are thinking, well, I think I need a device, and the book does not give you an option for that, then you need to go back and revisit. Is the root operation correct? Are the body parts correct? Then because this because that catheter did not stay in very long, that it's obviously not coded because it's not actually being inserted into the body to stay.
right.
Okay. And other times, and I have done this, especially early in my PCS coding years, that's exactly what would happen. Is I would get to like the 6th or 7th character and say, wait a second, it doesn't have a choice that I thought I needed to choose, and go back through all the other things. It's very good to always double check, but B, that's how you can say, oh, wait, this should have been resection, not excision, or whatever it might be. Okay.
Right.
And that's also,
When we were doing the coding, what I had to do was I kept going back and forth, especially with the quiz, going back and forth and reading again to make sure that that is what they were doing. Were they removing all of it? Were they not removing all of it? And just kept trying to figure it out. So
well, that's 100% correct. That's exactly what you're supposed to do. Is you go back and forth and check and double check, because this is super important, the work we do. So you want to be doing that. Now, remember, you've only been doing PCS coding for about 2.5 minutes. Okay.
Yeah.
You know, a year from now, you won't have to go back and forth so much because you'll be more comfortable, because you'll be used to using these terms in this order and how this works. Okay. So I know it's hard to remember that you're a newbie with this, and especially with PCS, because it is so different from ICD10CM and it's so different from CPT. So you have some experience with coding and interpreting, but this has a twist to it because it's not interpreted the same exact way. And why should it be easy? Then anybody could do it.
You're
and
right.
then they won't pay us big, huge salaries. Oh, wait, somebody forgot that part. Okay. Hey, where is my big, huge salary? Oh, okay. All right. Let's do an amputation. What do you say?
Okay.
Yay, good.
Okay, patient with type 2 diabetic Charcot's disease of the left knee and ankle, here for an AK amputation. AK stands for?
Above knee.
Above the knee.
Excellent. After satisfactory prepping and draping of the area, the sterile tourniquet was placed at the higher end of the left thigh. It was inflated to 300 millihega, whatever. The skin flaps were then raised in a fish mouth fashion with proposed bone transection at upper 1/3 of the high thigh and the skin incision extending up to the middle 1/3 of the thigh. The skin, subcutaneous tissue, and fascia were then incised along the line of incision. All the muscles were individually transected and visible bleeders were cauterized. The femoral artery, femoral vein, sciatic nerve were also identified, and they were all doubly ligated and transected. The bone was cut with a Gigley power saw, and then the rest of the muscles in the posterior compartment were also transected. The tourniquet was released, and all the minor bleeding that came from the muscular vessels were also tied. The patient did have open femoral artery and a good blood supply to all the muscles. So there was quite a bit of muscular blood vessels that we had to tie, but it was systematically done and satisfactory hemostasis was secured. The fascia was closed with 2.0 Dexon. The skin was approximated with skin staples. Pressure dressing was applied. Patient was sent to recovery room in good condition. Do we have any questions? Okay, let's build a code. All right, so what section of the PCS book is we gonna go for?
Medical surgical.
Med surg.
You're smart. And anatomical region. Now remember, in this amputation, we had the skeletal system involved, we had the cardiovascular system involved, we had the muscles involved, we had the derma, the skin involved. So how would you know what body system to look for?
It'll be lower because it's below the waist.
Anatomical regions, lower extremities. So yes, lower extremities are your legs. Anatomical region because we are talking about the thigh, which is a region of the body. And again, because it included work on all of these different body systems, we couldn't narrow this down to just skeletal, just muscular. So we go with anatomical regions, lower extremities.
Yes.
Okay. Everybody good?
Yes.
All right, next we have the left side was identified. So, and we know that it's an amputation, and we have here bone transection at upper third of the thigh. So this is a detachment is the root operation term used for amputation.
Mm-hmm.
And D for the specific body part in the fourth code character is upper leg left. Are we good?
Hold on.
The fact that it says above the knee, but that just includes the knee and the lower leg, right? That doesn't actually include any of the thigh bone, does it?
This is wrong. It's a urinary when it should be a Y.
Oh my gosh, you are correct. It should be, whoops. See, this is I only did this on purpose, so you would know how bad it is to copy and paste. Do you believe that? So now I'm going to copy and paste, but I'm going to copy and paste the correct thing. Okay. Look, now it's correct. I told you, Jennifer, auditing, man, okay. Is 6 correct for detachment?
Yes.
Yes.
Okay. And D as in dog for upper leg left. Upper leg is between the hip and the knee on the left side,
Yes.
right?
Okay.
Yes.
So then upper leg includes the knee, so that's why you say upper leg instead of knee region.
It's not the knee region.
It's the thigh.
It's the thigh. Here,
Okay.
let's go
See,
back.
I'm getting stuck on it being removing right above the knee. I wasn't thinking about it.
Oh, they call it an above the
Above the
knee
knee.
amputation because it
Yeah.
is above the knee, but this
Okay.
doesn't mean exactly above the knee.
Okay, that's where I'm
Yeah.
getting my brain
Okay.
stuck. Okay.
And take a look here. The bone transection at upper 1/3
Upper 1/3
of
of the thigh.
Thigh,
Okay.
And then the skin incision is the middle third of the thigh.
Okay. Thank you.
Because remember, in an amputation, they take off the bone, right?
Right.
Yeah.
But then they got to have extra skin to wrap around it.
Okay. Thank you.
Okay.
Okay.
That's why we're here. Okay. And just because this says urinary system, shh, don't look. There's a mistake on your computer. It's your computer.
I looked at that thing. I said, "Hold up, no, we're not." Even doing that."
Man, I am so happy when the two of you, all of you, come here and do that. This is good. This should give you confidence because that's what it's all about. It's about paying attention to the details. Okay.
That application quiz. After I got that little thing, I'm like, I don't know, man.
Well, we're going to take a look at that in a minute. Okay. So we have medical, surgical, anatomical regions, lower extremities.
Yes.
Detachment is the root operation term.
Yes.
The body part is upper leg left. And it obviously is an open procedure because they are seeing lots of the inside of the body. And of course, that's the key part. Okay. And then there is no device. And then the qualifier
would be the mid thigh.
The mid thigh, because that's where that happened. And so we end up with 0, Y6, D as in dog, 0, Z as in zebra, 2.
Yes.
Okay. So see, you guys can do this. You guys do this better than I do this.
If we're all together looking at
Jennifer, I was trying to reach out to you for help, but I couldn't. I said, oh my God, I cannot remember Jennifer's name. And then I got so frustrated, and it got to the point where I just said, look, I know I don't have all the answers right. I just submit because I had to go to work and it was late.
If you're like me, I got like a 60% on that application you're talking about, so I can feel your pain.
You know what? I don't remember getting an email from you asking me any questions.
I was working on it over the weekend, and
what I'm in here 7 days a week in the morning. Okay.
In the morning.
Not early in the morning, but okay. Now you said, let's look at this. What chapter?
It's the chapter 33. And it was the application quiz. It was just 2 questions, and it won't. Before it let me open it up and look at the explanation.
I'm surprised it didn't, but okay.
But just now it wouldn't let me open it up.
How rude!
I know.
Let's smack it around. No, I'm really not a violent person. Okay, was it Barbie Tuttle or the very last one you said, which is Lewis Kensington?
Yes.
The sphincterotomy with the fissurectomy or the hip arthroplasty?
No, it's the second one.
The hip arthroplasty?
No, the hip arthroplasty, I think, is the first one.
I don't know, because I think they like rotate. I have an inguinal.
It's Catherine.
Catherine.
Yeah,
Okay.
it's the one. It was in our application case of counters for chapter 30.
Yeah, there was only 2 of those.
It was just 2 questions.
Oh, I think those were the extra ones. Okay, let's see if I can do this.
And it didn't pull it
What
out.
school are we? Okay. Don't look at my password.
Oh, I can't see it.
Good. Go in there, change all the grades.
Ah, she got us, Jennifer.
Yeah, see,
I'm too
you know,
smart
she
for
knows I'm freaking out when I don't get an A on something.
Yeah.
So.
You sound like me. I got so upset. That thing said 50. I said, oh my God. Now, 2 of them, I see where I got it wrong. And it was off by by a number, a character.
I had to just tell myself, at least I got the numbers. I got them right.
But you know.
But I just didn't put them in the right order.
But I got 2 characters off.
All right, you said it was a quiz?
Yes, ma'am.
Okay, chapter, I don't see, oh, here it is. Okay. Chapter 33. Oops, oh, wait a minute. Okay. You both already took it, right?
Yeah, this was for last, it's closed.
I had to be due Monday.
Right, okay, just checking.
Yeah.
Just checking.
Yes, of course we've all taken it. Give us the answer.
Okay.
And if you could just help me figure out how.
Oh, this is Peter Patramon, so it must, of course, it's the other one. Okay. Here we
how
go.
to put it in the right order. I need to know how to put it in the right order is where I did it. I wrote it down.
All right, Catherine. All right, let's see if I can do this. Okay. And oh, cool. Okay. All right. So, can you see this document? I think I might have to rescreen my screen.
I think so. All I still see is your presentation.
Let's try this. Yeah. All right. Now, can you see, Catherine?
Ah, there we go.
Okay. All right. So we got chronic appendicitis with abscess. And the procedure is a laparotomy with appendectomy and right salpingo-oophorectomy. Okay, so appendectomy is what?
Appendix.
Remove the appendix.
Removal of the appendix.
So, right. And salpingo-oophorectomy?
Ovaries and fallopian tube.
And the tube.
Very good. Okay. So they left in her uterus, but they took out her ovaries and fallopian tube. Okay. The patient is 51-year-old female, admitted with abdominal pain, complained of lower abdominal pain starting on whatever, a ruptured appendix with perforation and abscess formation was suspected. Plans were made for surgery. Patient was taken to the operating room and placed on the supine position. General endotracheal anesthesia was administered. Foley catheter was placed in her abdomen, was prepped and draped in the usual fashion. Okay, a knife, just any old knife, what, like a kitchen knife? Okay, was used to make a right paramedian incision and dissection taken down through the subcutaneous tissues. What's the approach?
Open.
Very good. Okay, the anterior rectus sheath was divided and blunt dissection accomplished through the rectus muscles. Posterior rectus sheath and peritoneum were then opened sharply as well. There was a large inflammatory mass noted in the right lower quadrant. There was an abscess cavity entered, and this was cultured. The cecum was identified. The cecum. Where's the cecum? It's the beginning of the
large intestine.
Very good. And the tania were followed to where the appendiceal origin should be. However, there was a great deal of inflammation in this area. Oh, that means her appendix ruptured. Okay. The right tube and ovary were involved as well. Okay, that's why they took out that as well. Okay. So There was a tubular structure heading into the retrocecal area, which appeared to be remnant of the appendix. This was followed back to the appendix and a straight clamp placed upon it. This was then doubly tied with 0 vicryl ties. Structure was adherent to the tube and ovary. A large inflammatory mat. Wow, this sounds like a mess. Ew. A tube and ovary were excised by clamping their blood supply and tying these off with vicryl ties as well. Specimen was passed off the table? Oh, the specimen.
Yeah.
Okay. The area, I was imagining the patient being, I was like, what? Okay. The area was irrigated with copious amounts of saline. Hemostasis was good. 10 millimeter Blake drain was placed in the abscess cavity and taken out through the lateral stab incision. This was secured in place with a nylon structure. Again, the abdomen and pelvis were irrigated and suctioned out. The posterior rectus sheath and peritoneum were closed with a running suture, and the anterior rectus sheath was closed with a running suture. Subcutaneous tissues were irrigated with saline and the skin closed with staples. The patient tolerated the procedure well. Okay. So, what do you think it was the primary or the principal diagnosis, ergo, which procedure was the most difficult, most important, most severe?
The appendix. They had to remove the appendix.
Yeah.
That's right. So I thought, so why did you thought that you said you got the order wrong?
Okay,
there's 4 different codes.
Yeah, you had to do 4 codes.
Okay.
So this is what I did. I'm gonna pull my code up that I used.
Okay. Whoops. Can't look up codes in the textbook, you know.
W. J. Okay.
ODT.
Okay, the first one I got was, and I got it out of order for one thing.
Okay.
And then the first one should have been ODTJOZZ.
That's correct.
But the one that I put first was the one that was OWJ.
Okay, but hang on. I just asked you guys what you thought the most important, most severe procedure was, and you said the appendectomy. So why didn't you code the appendectomy first?
Then I did it. Then I put the wrong when I did go for the I did ODT. Okay, let me go to what I did.
ODTJOZZ is the appendectomy. That's correct.
Okay, but what I didn't put that.
Oh.
I put ODTJ, and then I put a 4 instead of I don't know why.
Okay, I know why.
Because I read something, and that's
right
why
up here. Right up here. On the top where it says operative procedure, it says laparotomy.
Yeah.
And you took that to mean laparoscopically.
Yes.
Laparotomy means what? Abdomen, incision. Laparoscopic is abdomen, instrument to view.
Okay, because when I did that, and then I said, well, no, I don't think so. I took it off, and I moved both of them, and then I went back and I said, well, no, maybe, and then I changed it from the 0 to the 4 again, and I was like,
okay, all right, no. So I understand. So you made an incorrect assumption.
Yes.
From this one word up here, operative procedure laparotomy. Okay.
Yes, ma'am.
Understood. Understood. And you know what? Fair and reasonable.
Okay.
But as I was reading through the op notes, when we got to a knife was used to make a right paramedian incision and dissection taken down through the subcutaneous tissues.
Okay.
And I said, what does that tell you about the approach? You all did open in unison.
Yeah.
Okay, and that's why I said, now, laparotomy, that's easy. Actually, the first time I looked at it, I thought it was laparoscopically, okay? But that's exactly why you have to read all
And then I
of
read it, and then I read it again. I'm like, well, maybe, and it just got flustered. And then,
you tied yourself up in knots.
and I kept going back and forth and back and forth, and then I just got so confused because when I went to the alphabet listing, and then I started looking, and then it was like it was like I should have done that, and then I just got all mixed up.
You mixed yourself up.
Yeah.
Okay. Now, OWJ.
And I did the same thing with I did instead of open, I did the wrong code and in the wrong order and then the wrong code.
Oh. All right. The wrong order. I want you to always remember OWJ.
Mm-hmm.
Oh, I had 2 pages stuck together. Okay, inspection G,
Yes.
peritoneal cavity. Okay, so OWJ, G, O, because it's open, it's really only one open procedure, but he did everything while he was in there.
Okay.
Excuse me, she, it's a female doctor.
Oh.
Okay. And then we had the salpingectomy and the oophorectomy.
Now I got those. I got those codes correct.
But in the wrong order?
In the wrong order.
Okay.
I put the ovaries and then the fallopian tube. I'm looking at, like the ovaries kind of.
See, that's what I was going to say.
So the ovaries kind of stay out and then the tube comes down. So that's why I was thinking the ovaries.
But I think you're correct.
I thought the ovaries come before the tube because the tube is lower
down. And the
down.
ovaries are bigger than the tube.
And then I went to the front of the book and looked under the female reproductive system.
Good for you. No, that's all correct. Okay, you are right. This was entered in wrongly. I would agree that the ovary should be reported first and then the fallopian tube.
Because I was like, hold on. I looked and then I said, well, especially when I saw the grade and I was
so did you get the rest of the codes correctly?
I got the code for the fallopian tubes. I got 0UT50ZZ.
Right.
For the ovaries, I got 0UT00ZZ.
Good.
So I got them both on right, but not in the order.
And you got the appendectomy code correctly?
No, that's where instead of
that's where you put the 4. What about the OWJGOZZ?
I changed it to I thought I changed it to a 0, but then when I submitted and look, I didn't change it back because I kind of highlighted it where I could come back to it.
I'm going to give you back the 50 points for the 2 that you got correct. You just put them in the different order. What about you, Jennifer?
Yeah, I did the same thing. Now, I did not get the OWJ right. I got stuck on drain for some reason.
Okay.
So
did you get the appendectomy?
But I got appendectomy completely right, and I got both of the ovary and the fallopian tubes right.
But you know what, Jennifer?
Okay.
You know why you
but
got
not in the right order.
You know why you got that for the drain? Because when we looked under the alphabetical, it says drain also.
Yeah, exactly. Yeah, and that's I
Again
just
with
got
the
stuck on that.
drainage. What is this book? What is this index? Everything goes to drainage. They
It
did
has
the same thing with
it
the
has
penis,
drainage and it
right?
has
because they inserted a Blake drain and
yeah.
left it in there, secured it in place. So
And
that's where I'm getting
okay.
stuck. Yeah.
How about you, Lawanda? Are you back, Lawanda? I think she's still with the motorcycle.
Oh.
Okay. I
But
am
yeah,
going
that-
to
that was
I am going to give you back your points.
now when it comes to like the ovaries and the fallopian tubes, is it above and then below in the order?
Here's the rule.
Okay.
Okay. Severe
Okay.
in decreasing order.
Uh-huh.
And then we have head to toe.
Okay.
Okay.
So
So
severe.
the ovaries are above the fallopian tube.
Okay.
So yes, the ovaries would be reported first.
So it would have been the because of the ruptured appendix, that would have been first. And then
The inspection of the peritoneal
would
cavity.
have been next because it's less severe. But then when
Right.
we got to the ovaries and the tubes, it was both of those were equally severe, and the ovaries before the tubes, right?
Right.
Okay.
Exactly the
just-
right thought
just
process
take level.
also. Exactly. The most severe is the most severe. Equal severity. So then we go head to toe.
Okay, equal severity head to toe. Okay.
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 So
Fantastic.
I wrote that down.
Yeah.
Good.
Look, I listened to the videos.
Good.
I listened to the videos and look for notes. Jennifer, please change numbers with me.
All right, wait. Let me use the chat box. Let me turn off the recording so you guys can